the continuation of the previous video of the anticholinergic drugs. Now I'm discussing the side effects. Side effects in the cardiovascular system is increased heart rate in the CNS. It lead to the CNS excitation, restlessness, irritability, disorientation, hallucination, and delirium. Now in the eye, it dilates the pupil, decrease visual accommodation, and increase the intraocular pressure. In the GI, it decreases salivation, decrease the gastric secretion, and decrease motility. These are some side effects as you can see in the picture. In the eye, blurry vision and dry eyes. In the mouth, dry mouth and the bowel, constipation, skin flushing, unable to sweat, and overheating. In the bladder, it leads to the urinary retention. In the heart, rapid heart rate. In the brain, it leads to the drowsiness, dizziness, confusion, and hallucination. Now the side effect of the anticholinergic in the genitourinary is urinary retention. In the glandular, it decreases the sweating because it decreases the all secretions of the body. In the respiratory, it decreases the bronchial secretions. Now the toxicity of anticholinergic overdose syndrome is characterized by hyperthermia, delirium, dry mouth, tachycardia, alias urinary retention, seizures, coma, and respiratory arrest may occur. Treatment include the gastric lavage with the tannic acid, cold sponging, or the ice bag, or the drug use is physostigmine. This is the anticholinergic Toxidrome symptoms. As you can see in the right hand side, hot as a desert, that means hyperthermia. Dry as a bone, that means dry mouth. Mad as a hater, that means confused. Mydriasis, dilate pupil. Red as a beet. At the left hand side of the picture you can see above the cactus, red as a beet, that means flush skin, and the absent bowel sign, tachycardia, etc. This is a clear picture of the previous blur picture. These are anticholinergic side effect: hot as a hair, dry as a bone, blind as a bat, red as a beet, and mad as a hatter. Now these are the some contraindications of the anticholinergic drugs, that are glaucoma, prostatic hypertrophy, urinary tract obstructions, GI tract obstructions, infectious diarrhea, reflux esophagitis, and all these are the contraindications in which the anticholinergic drugs are not prescribed. Now the individual drugs of anticholinergic classification and its particular indications are atropine. Atropine is a prototype and it is an antidote in the OP poisoning. Ipratropium useful in the rhinorrhea, also excellent bronchodilator. Scopolamine depresses the CNS and causes amnesia, drowsiness, euphoria, relaxation, and sleep. Also good for the motion sickness, given parentally, orally, or transdermally. Next is benztropine, temporary use in the Parkinson's disease, useful for dystonic reaction caused by antipsychotics. Next drug is trihexyphenidyl, also used for treating the EPS by some antipsychotics, contraindicated in glaucoma, fluctuate belief, dysuria, urgency, frequency, and pain with GU infections. Oxybutynin has direct anti-spasmodic effect on the smooth muscles and anticholinergic effect, decreased frequency of vomiting. These are some questions to analyze your concepts. Atropine overdose may cause which of the following? Option E, GI smooth muscle cramping. B, increased cardiac rate. C, increased gastric secretion. D, pupillary constriction. E, urinary frequency. Next question, a direct acting cholinergic that is a lipid soluble and often used in the treatment of glaucoma is acetylcholine, phenacophycostigmine, pilocarpine, or neostigmine. The third and the last question for analyzing your concepts is ANS is also known as visceral vegetative involuntary nervous system or all of the above. Leave your answer in the comment box, so let me know about your concepts. That's all about this topic. Hope you can understand this topic, and Allah Hafiz.